Hey guys, so today I'm going to talk about borderline personality disorder, or BPD, and the different types of therapies that are used for it. So I chose this topic because I suffer from BPD. I was diagnosed about 2 years ago, and I've always wanted to learn more about it just to understand who I am, and I really want to educate the public on it because not very many people know what it is or how to help people with it. So, borderline personality disorder is a personality disorder that is made up of 9 different criteria. So the American Psychological Association defines those 9 criteria as disregarding having abandonment issues, unstable relationships, constantly having low self-esteem, lack of self-control, consistent suicide or self-harm behaviors, abrupt mood changes, always feeling empty, intense feelings of anger, and possible paranoia from stress. So BPD is usually only diagnosed in adults, so anyone over the age of 18. This happens because as a child gets older, their brain develops and matures, so their symptoms can go away as they get older. In people with BPD, they tend to have an all or nothing judgment. So they think one way or the other. There's no in between or middle ground. I like to say that they're very black and white and that they don't have a gray area. So they only think one way or the other. So the main type of treatment for BPD is psychotherapy. Psychotherapy is a type of talk therapy that is used for BPD patients, and the goal is to help people focus on their current ability to function, help to learn how to manage their emotions, help reduce their impulsiveness, and help improve their relationships. So there was a study done over psychotherapy that determined if 1 year of psychotherapy can change how a BPD patient describes their life story and their parents' life story. So there was 30 BPD patients in the study and 30 controlled participants, but only 23 out of each group actually finished. The study asked the participants to describe their own life story and their parents' life story. So after 1 year of psychotherapy, the results of the study were that the patient's stories increased significantly in agency, so how long they view their life lasting. And the parents' life story didn't actually change very much, so the only increase was their personal stories. It found that psychotherapy was a helpful type of therapy for patients with BPD to help them see a future in their lives. So there are many different types of psychotherapy, but the main type for BPD is DBT, or dialectical behavioral therapy. DBT is one of the most used forms for BPD, and it is a skills-based approach that teaches patients how to take control of their emotions, deal with distress, and work on personal relationships. So the main goal in DBT is to help reduce the urge to self-harm or have suicidal thoughts or behaviors. There was a study done in DBT that compared the effectiveness of DBT to an optimized treatment as usual, or OTAU therapy, in college students. So these students ranged from 18 to 25, and they were all seeking help in their college counseling centers. So to get into the study, the participants had to have at least 3 criteria in BPD, at least 1 past self-harm or suicide attempt, and have current suicidal thoughts. There were 63 students total. The treatment lasted from 7 to 12 months, and there was assessments taken at the beginning of the treatment at 3, 6, 9, and 12 months, and then again at 18 months as a follow-up. The results showed that DBT was more helpful than the OTAU in decreasing suicidal thoughts, depression, self-harm behaviors, and the BPD criteria that they had. The conclusion was that DBT was an effective therapy in treating college students with BPD. So this video is basically to help educate anyone on borderline personality disorder, and the point is that not very many people know anything about it, and I hope that this helps you learn more about it and maybe read about it. Thanks.